suffer from lower back pain? Poor lifestyle choices like smoking, lack of regular exercise, bad food habits, incorrect posture, and many others may be to blame. The pain you feel in your back is most oftentimes caused by having what's known as a slip disc. A slip disc is basically a bulge on one of the discs that are between the tiny vertebrae in your back. Poor lifestyle choices and back trauma are the primary reasons for this condition. When the disc bulges out far enough to press on the nerve, it causes pain, sometimes more severe than others. Pain radiating to the hips, back of the knee, heel, and toes are all pretty common. If you're suffering from lower back pain, the bottom line is that you just cannot neglect it any longer. Good chiropractic care will help you finally find the relief you need and live the pain-free life you deserve. We have years of experience and thousands of satisfied patients. We would love to reduce your pain and have you be our next happy patient. Contact us today.
So tell me, please, what's going on? What brought you into the office?
So a couple months ago, my hip started to hurt, and then now I have like hypertension in the flexor area.
Okay.
So, and I was looking on YouTube as well that might be a side effect of disalignment
In
on
pelvis.
here. Right. So then that's the reason I'm here, but also, like I'd say I have a 10-year like battle with neck problems as well. So and also like and my back. So I'd like to get like 3 birds with 1 stone.
Okay.
But right now, the really debilitating injury is the hip.
The hip. Let's start from the bottom and then move up. So in terms of the hip pain and back pain, was there like an accident? Did you fall down? Did you lift something heavy? Was there any event that could have caused it?
I literally woke up one day and I couldn't walk.
Okay.
And then since then, there's been good days and bad days.
Okay. What about your neck? Same thing.
Same thing, yeah.
So the next question will be: have you had any chiropractic care or maintenance care in the past?
One time for my
Just
neck.
one time?
Well, I mean, with one doctor, maybe 4 or 5 visits.
Okay. And
Yeah,
did you have any relief or?
I believe I did, yeah. Cause I mean, I don't really like. I'm like scared of like chiropractors, so we waited until I couldn't, like I still can't kind of, but we waited till I couldn't rotate my neck at all to go to chiropractic. Just like now, I waited until I can't walk without. I feel like this leg's way taller, so. But yeah, it worked and it came back because I didn't go back. It was like I think 6 years ago.
Okay.
Yeah.
So at this point in time, the main problem is back, and then the secondary is your neck. And
The
you,
hip.
you said there was also
right.
number 3. What was the third one?
The hip and the neck hurt the most, and then the back is almost like a side effect.
So most likely hip and the back, they're interrelated,
Right.
Because they're part of the same unit, biomechanical unit. So it just basically it's been a while since you've seen a chiropractor.
Yeah.
And what kind of care did you get? Just an adjustment? Did you get anything else besides the adjustment?
He had like some big bed that a ball would come up from under you and then go from like tailbone to neck. I don't know. It was like after he aligned you, he would do like some physical rehab, and then put you on that table and the ball would like align you.
He would roll?
Yeah.
Okay, that's weird.
It looked fancy, I don't know.
Oh, it's probably deflection, destruction too.
Yeah.
And you said it's a right hip, right?
It's the right.
Any shooting pain down your right lower extremity?
No, just
it's all localized?
Yeah, flexor and back.
Okay. What's the level of pain in your neck, 1 to 10?
Right now?
Yeah.
The pain is about, just standing here is just like 5, it doesn't really hurt.
Okay.
But trying to move it at all, I can't, so.
It hurts really
Yeah.
bad. What about low back?
It doesn't really hurt at all. It's
What about hip?
the hip, yeah, it's like a 10.
10.
I can't move it and it hurts.
Okay.
Right now it's the mid back. I think just was laying down. I can't do anything, so I just lay down all day, and then my back gets really tight.
Yeah, you're lying down, getting rest.
Or over resting.
Over resting or even resting, no movement is worse than the worst thing you can do for the back that hurts.
Yeah, and it's funny, even though it's like a soft bed, it's still debilitating.
Doesn't matter. I mean, doesn't matter whether it's soft or hard. It's just the fact that there is no
Not
motion.
moving,
Yeah, that's.
yeah, when I was 4, too, well, they diagnosed me with arthritis. I went to a lot of doctors when I was like 4. My legs started hurt. So they diagnosed with juvenile arthritis. Some doctors said I have some nerve pain or a nerve pinch like on my tailbone, around the tailbone, and that it would get better over time. And then a lot of doctors said I don't have anything. I'm faking, crying in their office because of pain. But I feel like that nerve has, because over time my leg got a lot better, but then my neck started hurts. Maybe the pain moved up. I don't know.
Okay.
Well, I don't know what the root of my neck pain ever was.
Well, let's figure this out right now. Let's get some answers and see what's happening. Okay. So the medical doctor just gave you prescription medication.
No.
What did they do?
What do you mean?
Like when you went to see a doctor for the neck pain, you said they were not able to figure out anything. Oh my God, it doesn't move at all.
I don't like getting it cracked. It trips me out.
Well, they're gonna have to crack it.
Is there a way you could do it face down?
On your neck?
Yeah.
I can do it face up, which is not gonna be as efficient as sitting down.
Okay.
But if you want to get some results, sitting is the best. If you want to be more relaxed, I can put you face up, not face down. It's not biomechanically feasible, so to speak.
Right.
We'll get you comfortable. Don't worry about it. Okay. You've seen the videos, right?
Yeah, I mean, it looks easy, but
It is easy.
I can't do it. I'm traumatized.
I've done this for 15. Any heart pain around here?
Yeah.
Okay. I've done this for 15 years, so been adjusting legs for quite some time. So you're not the worst case scenario that I've seen. Okay. Then forward, please. Back. Forward again. Okay. Okay, stand up. Please do march in place. Stop. Don't move. Oh, no wonder you have a hip pain. Your right hip is more than 2 inches lower than the left one. So you're basically exerting thousands of pounds of weight every month on your right leg more than on the left. Have a seat, please. Let me show you. Okay, so basically this is you looking at yourself from behind.
Right.
So your pelvis, this is the right side, it's 2 inches lower than the left side. And you see the leg, you see this socket?
Right.
The right leg, you said the left side, right? So this is the left side. The left leg is attached here. So when there is such an angle, so when you walk, all this, it's called acetabulum. There's a soft tissue around here. It's like a ball with some oil lubrication in here. So biomechanically, it's like putting a lot of pressure here on the soft tissue. So every time you walk, you irritate it. And imagine doing it like for such a long period of time. As a result, this is wearing out a lot faster. So this left hip is working like, 10 times more, takes more load than the left hip. So and this one, the leg is longer, so it's put more pressure, more abuse. That's why I'm feeling this pain. And then the back pain is like a secondary because it's out of alignment. Okay. And then since it's out of alignment, spine is a gravity-dependent structure, so it starts compensating. As it starts compensating, your neck is going to be locking up too because it's going to compensate for the problem here at the bottom. Make sense?
Yeah.
Okay.
The neck pain's always been there.
Yeah. So you're looking at yourself from behind basically. Your right hip is about 2 inches lower, more than 2 inches lower than the left one. right foot is out to compensate for the leg length difference. Your left shoulder is like an inch higher than the right one, and then your right ear is about half an inch higher than the left one. So we need to make all these lines parallel. Okay? So what I'm gonna set you up for hit and stim, and then I'm gonna adjust you, and then I'm gonna see my massage therapist and see how you feel, and based on that we'll figure out the frequency of how many times you need to come in. Maybe you need to come in a few more, maybe you need to come in 6 or whatever.
Right.
I mean, I don't know. So like, I'm not selling plans.
No, yeah, no.
Just to sell it, so just come in. I
no.
don't do it here.
Yeah.
So I just want to make sure we're on the right track, and just want to see if there is any response even after the first visit. And even if we get like 20% improvement, that's already a big step, considering that how much pain you have.
Right.
Okay. So before we move forward, do you have any questions?
No.
Fix me up.
I might shed some tears.
Okay. Well, that's okay.
Right. I hate it so much.
You hate what, the pain or the adjustment?
The adjustment.
Okay. So now I'm gonna adjust your middle back. Okay. Okay. I know you're scared, but just try to relax. Okay. Take a deep breath in. Out. Try not to tighten up. Take a deep breath in. Out. Okay. Breath in. Out. Okay. Now go on your side, please. Face me like you sleep on your side.
Oh fuck.
Okay. Hurts?
Yeah. It's not. I can't go up with it.
Okay, it's okay. Just relax. Okay, I'm gonna do all the work. Just relax. Okay. So tighten up. Relax your shoulder. So you're gonna have a feeling that you're gonna be falling off the table. So just relax. Okay. The hip hurts.
Yeah.
Okay. Just relax. I'm gonna push you down like this. Ah, that moved quite a bit. Okay now?
Yeah.
Okay, give me a hand. Alright, put the feet down. Did you feel that popping noise?
Yeah.
Huh?
Yeah.
Okay. Lean back.
This is the part.
Okay, just close your eyes. Imagine you were somewhere in Hawaii. Close your eyes. Close your eyes. It's okay. Just a little bit here. Relax. Relax. It's very stiff. Your neck should be moving really easy at your age. You got a neck of a 60-year-old guy. Okay, go on your side.
That's how it feels for sure.
That's what it feels like? You're too young to have these kind of problems. Okay, give me a hand. Let me see. Relax your shoulder. Relax your shoulder. Okay. Sit up. How's it feel?
Oh, what? My neck?
Your hip and your back.
My hip feels better.
Huh?
My hip feels better.
Was it hurting when you're sitting more or when you're standing more?
When I stand.
Okay, try to stand now.
It's still sore here, but
It's
not as forward. It's not as forward.
What about the intensity? Is that as bad or is it a little bit better?
No, I could put weight on it, so it's a lot better.
Huh?
I can put weight on it, so it's a lot better.
Okay, good. Good. So what we're gonna do next, I'm gonna send you to my massage therapist, Gail, and I'll also ask her to work. You might have to put your pants down and expose this area, so she can work on this area.
Yeah, that hurts.
All the soft tissues come
Right,
probably,
right.
then she can work around here, in the hip area, right around here,
Right.
and then also the neck, but mostly the hip. Because that seems to be like the worst problem. Your pelvis was literally like this.
Yeah, just laying down during the heat thing, it was hurting just being straight.
Try to sit and stand up. Does it feel the same as it was before you come in?
Yeah, it's definitely better.
Yeah, better? Right on. Okay.